Okay, so this patient is a 53-year-old woman who had fatigue, constipation, cold intolerance, impaired sleep. BP is 140/100, heart rate is 50, respiration is 16. Okay, temperature is 36. So she's a 53-year-old woman with 3 months of fatigue, constipation, cold intolerance, and impaired sleep. She says that she has gained 9 pounds during this time. No fever, vomiting, abdominal pain. History, past medical history is hypertension, carpal tunnel syndrome, and allergic rhinitis. She's taking hydrochlorothiazide, loratadine. She does not use tobacco, alcohol, or illicit drugs. Last menstrual period was 2 years ago. Pap smear, mammo were normal. Colonoscopy performed at age 50 and was also reported to be normal. So we don't need to do colonoscopy. We don't need to do mammogram. Maybe mammogram because it's every 2 years. Pap smear we don't need to do it. She's a 53, so what else do you want to do? Maybe she's she's not a smoker or alcoholic, so you don't need to counsel on that. So there's nothing we can do. Just influenza vaccine. Just so this is the 2-minute screen. Okay, so now you got the idea of what she's having, right? What do you think? What's your differential?
She has signs and symptoms of hypothyroidism.
Yeah, that's most likely. So let's do complete physical, right? What do you think?
Yes. Anybody who comes to the office, you should do a complete physical.
Yeah, you're right. Yeah. Unless it's something urgent, like for example, if it's a PCP pneumonia or something like that, then we just do it. Okay, skin is cool, dry, abdomen is unremarkable, delayed deep tendon reflexes, and she's obese. Okay, so now what do you want to do? Let's do CBC, CMP,
Let's do my mnemonic, the cut gleam, but you can do it your way.
Yeah,
The same one, CBC, CMP, chest x-ray, UA,
panel.
finger stick.
Yeah, chest x-ray, let's do that. Chest x-ray, lipid panel, LBT, TSH. You said finger stick glucose?
TSH, that's what we did. We can do
ESR.
EKG, because she could have.
Yeah. LFTs, ICU.
What else do you
do? Maybe iron studies, maybe we do it after CPC if she's
Sure.
anemic. What else? What do you want? The PT, PTT, INR, leading time. It's not that important, but that's okay. So what else do you want to do?
You can give her.
We did urinalysis, right?
You can give her Colace for constipation.
Yeah, you said Colace?
Yeah, stool softener.
Yeah, we can give her stool softener. So urinalysis.
So can you check for vitamin? Like,
vitamin, which one? D. Vitamin D deficiency can cause that fatigue too.
We can check her urine culture. Just make sure, like, even though she doesn't have anything going on, you never know.
You want laxative, let's say, give her some laxative.
She gained weight, so she could have, like, I don't know, something going on.
Yeah. Spironolactone.
Have you taken any practice tests?
For
step 3?
Oh yeah, I did the one. How
Which
about
one?
you? Huh?
UWorld assessment?
Yeah, now we do ESR and a titer, just in case. EKG, PT, INR, PTT.
It's a 4-hour test, right?
Hmm? Yeah,
Four.
it's 4 hours, yeah. Yeah, it's only measure the MCQ components.
Mm.
Doesn't measure the CCS, so, and your CCS is really good, so you should be good to go. Yeah. So now, what do you want to do?
I want to move the clock. Let's see some tests results.
Do you want to keep him? And
Yeah, I want to keep her for at least TSH.
so her hemoglobin is 11.
Mm-hmm.
Platelet and stuff is fine. BMP
Mm-hmm.
sodium is 133. TSH is a 24.
Mm-hmm. Oh, TSH is 24. What about T3, T4?
We only ordered TSH first, and then we ordered T3, T4.
Mm.
So what do you want to do now? It's obviously it's hypothyroidism since the TSH is high.
Yeah, so we
TSH,
can give her levothyroxine,
yeah.
or we could check T4.
This is free T4. There's a levothyroxine. Yeah. Okay. Diet. Let's give her low-fat diet because she's obese. What else? Anything else?
Now we can send her home and call her back and then see how she's doing.
Okay.
No, no, oral. Can you give her Colace? She's constipated.
Hmm. I give her laxatives.
Oh, you did? Okay.
Yeah. Low fat. Okay. Now let's cancel her before we send her. Right? The main thing is adherence and counseling, education.
Medication compliance is very important. She cannot take, there is
What?
some, she has to take this on empty stomach, right? The medicine? Or you don't advise that, right?
Yeah, but there is, I don't know, is there any counseling like this?
I don't know.
I've never heard of it.
It's okay.
Yeah. Okay, so now what do you want to do? We'll just send her home, see her in a
I
couple
can
of
call
days.
her in a few weeks, right?
Yes.
Takes to kick in.
Like, when do you want to call her? Let's call her in a week.
Yeah.
See how she's doing. No, okay, T4 is 0.03, normal is 0.9, so it's decreased.
Yep.
Lipid panel shows increased cholesterol. So we
Okay.
look at the LDL. If it's more than 190, we can add steroid.
Sorry?
We can have statin, I mean, sorry.
Statin, yeah.
Yeah. Now, in 1 week follow-up, what do you want to do? What test do you want to order?
I'm gonna, I don't know, what do you do? Just check her
Like, what do you do? What test do you order to monitor the
CBC,
response to therapy, huh?
CBC.
No, how do you know
I
the
mean,
response?
not CBC, TSH.
TSH, excellent. Yeah, we should just check TSH on that follow-up.
Yeah.
Just to monitor the response to
Mhm.
therapy. If it went
Therapy.
down, that means it's working.
Yeah.
No, I just sent her to see her like in 2 weeks or so. Yeah, see, and that's it. We did good. So that's the most important thing. So how would you summarize this case?
We didn't give her vaccine. Pap
Oh,
smear.
which one?
Mammogram.
No, so because that's the thing. Because she had it 2 years ago. That's a maybe. No, maybe mama, only mama. The pap smear she had it 2 years ago, so you don't need the.
Oh, ammo she needs, and then vaccine influenza.
Yeah,
Then she
but
needs,
that's the thing. Like with the vaccine influenza, like it's only if she's coming in winter. But we
if
can,
she's gonna what?
if she's coming like during winter time, like in September or something. But you
Oh,
can, yeah. But it's okay. I think it
it
shouldn't be
doesn't matter.
shouldn't be a problem. Yeah, that's about it. Colonoscopy.
She came in this.
She had the colonoscopy and everything else.
Yeah.
It's really nice.
So the way I'll summarize this case is anybody who has fatigue, constipation, um, DTRs are slow, and weight gain, and cold intolerance, and all of these things, you should have hypothyroidism on your top differential, and then that should tailor your on the test you want to order. So very first thing you order for anybody who you are thinking that they have hypothyroidism is TSH, and then once you figure that out, then you order T4, and then you put them on levothyroxine, and then you send them home and monitor after a week or two, and you check the TSH level to make sure that it's working, and the TSH should drop, and then you counsel the patient, you give them symptomatic treatment like stool softeners or even something, and then just kind of counsel. Yeah.
Okay. So what could cause microcytic anemia versus macrocytic and hypothyroidism?
Hypothyroidism and anemia.
Yeah. Hypothyroidism plus microcytic anemia. Hypothyroidism plus macrocytic. What's the why? Why could that happen?
I'm not sure.
So microcytic, if the patient, so when you have an autoimmune disease, this is predisposed to another autoimmune disease. Like for example, celiac disease can cause microcytic anemia with hypothyroidism. This one, or so this antibodies that attack thyroid attack the gut can cause celiac, can cause microcytic, or the antibodies can attack the stomach, cause pernicious anemia, cause macrocytic anemia.
Hmm.
So this is how you can have association of that, because 10% of hypothyroid symptoms they have pernicious anemia
Right.
of Hashimoto. Yeah. Do you need to measure the antithyroid antibodies? When do you measure them?
You measure thyroid antibodies if you suspecting Hashimoto's?
Hmm? So this routinely now we didn't do antibody.
No.
Yeah. Do you think we should have done that or no?
No.
No. So the only time you order antibody is like with this situation. This is very important. It's only step 3 specifics not mentioned in step 2. There's a condition called subclinical hypothyroidism. So when you
Mm-hmm.
order TSH you find a 5 to 10, which is
Mm-hmm.
like high, kind of on the higher side, like a 5 to 10. And the free T4 is normal.
Mm.
Okay, this is one is called subclinical hypothyroidism. So the only way to find out is that antithyroid antibody. That's the
Mm-hmm.
only time you would need to test for it.
Mm-hmm.
Okay, so because patients who have high titer of antithyroid antibodies, most likely they have permanent hypothyroidism.
Right.
So that's why you need to start them with thyroid replacement, and you check TSH in 6 weeks to monitor response.
I
How
see.
about if the patient is postmenopausal, like this patient? What else do you order? That's important.
Give her iron.
Hmm? Give her, yeah, calcium and vitamin D is very important.
Mm-hmm.
Okay, so that's the thing. Yeah, so just do the catiglin mnemonic, and then you put the you give her thyroxine, and that's it. The case should be fine.
What did you say that what causes macrocytic in hypothyroidism?
So 10% of people who have Hashimoto thyroiditis,
Mm-hmm.
they have a pernicious anemia
Mm-hmm.
when the antibodies attack the parietal cells.
Yeah.
When you have attack parietal cells, so you don't have
vitamin
anything
B12
anything that
absorption.
yeah, anything that's
And
good intrinsic factor. So there's no absorption of vitamin B12, so they have B12 deficiency.
I got it. Thank you. Yeah.
Yeah, so that's how it is. Oh, okay, there's another case. Let's do one more case and then we'll continue later. Okay, now this is a good case, a pediatric, two-year-old Caucasian child is brought for evaluation of loose, greasy stool and failure to gain weight despite adequate nutrition.
I know what it is.
Huh? Yeah, you know what it is. BP is 80/50.
Mm.
Temperature is 101. Okay, pulse is 100. Okay, he's in the office. Now the full physical, his other problem, intermittent productive cough, rhinorrhea. Patient state that he has wheezing, coughing up, purulent expectoration. For 4 days, they deny fever or chills. He has pneumonia 4 times since birth. Delivery of the child and neonatal course were uncomplicated. He was breastfed till age 4 months. And there's history of cystic fibrosis in the family. So they give you what's going on. Now, so how do you approach with a child who's have failure to thrive? So this is the case with the case of. So what do you do now?
So I'm gonna examine him fully,
Yeah.
and once I examine him, I'm gonna start ordering. I'm definitely gonna order a sweat chloride test amongst everything else that we normally do.
Yeah. So now when you examine him, you found the weight and height is lower than expected, hyperresonance, scattered crepitation bilaterally on chest, wheezing during expiration. So that's the thing. So this is clearly, this kid is going through big issues. So the first thing I would want to do, what do you think? The first thing.
Um,
Send him to
are
inpatient.
you gonna send him to the hospital? Yeah.
Yeah, let's send him to inpatient. This kid is going through a lot. Like,
Yeah.
it's crazy what he's going through. So let's do the police BS and B panic. Pulse, oxygen, maybe
I
excess,
access IV fluid.
fluid,
C
cardiac
for yeah.
monitor, BP monitor, finger, take a glucose, vitals, blood rest.
Bed rest
Okay.
already.
Yeah, let's put him. Hmm?
No, no, that's fine. That's fine.
What is
Oh,
it?
because he's inpatient. Okay, okay.
Yeah, NPO. Let's do CBC. What
Then
else? What do you want to do?
CBC, CMP,
Let's do
the
infection.
whole
Infection.
9 yards.
Infection protocol. That's important. Sputum. Blood
Can you do
culture.
blood culture, urine
Yeah.
culture?
Yeah. Let's do chest X-ray. Okay.
Can you do sweat chloride?
Yeah, that's an important one. Sweat chloride. Let's do some stool studies. Let's do
Can you do
TSH.
something with pancreas enzymes? Like, can you check something or no?
Yeah, that's a good idea. Analyze lipase.
Um, okay, I think that's good. It's a lot of stuff.
Yeah. So what do you want to do? What else do you want to do?
What else?
Yeah.
Heart clean. We did all of that. We did the police. We did the panic.
Okay, let's get some results and then let's get
Mm.
some results for now. So this is the stabilizing orders, oxygen.
I wanted to do a case of pancreatitis with you. You didn't. You said you will do it.
Yeah, we will do it.
You didn't even do it yet.
Should be coming on. Yeah, we still have some more cases.
Oh, okay.
Yeah. Hmm. Sputum, what do you want to do?
Sputum cytology, sputum gram stain, sputum culture. That's it.
Yeah. What type of chest X-ray do you want? What type of chest X-ray? Portable or lateral?
Yeah, we can do portable. Whichever doesn't.
Yeah, we can do lateral.
Lateral, yeah. Portable is for the ER.
Sure. Stool volume, that's the most important one for pancreatitis, but what else? What other stool stuff do you want to do? I think that's the most important one, fecal fat.
Just stool fat. Yeah, that's it.
I don't know, what the heck is the difference between these two?
They have two of the same.
Okay, TSH, that's okay. Sinus X-ray. Okay, now let's just get some results. No, so you got sinus thickening and the X-ray, there's infections going on, local infiltrate, and you're still having fever. Okay, so now we got the X-ray results. So now what do you want to do? He's having some sort of infection. So what do you want to do for that?
So he may be having a pneumonia.
Yeah, so let's do it. What do you want to do for?
I want to give him something for the pneumonia.
What is it?
Cefepime. I don't know.
You can give him amoxicillin, clavulanate.
Okay.
Okay, amoxiclav. What else? He's having wheezing, so we'll give him albuterol. What else do you want to do? So there is something that we always order, just physiotherapy.
Yes.
Okay. Now I'm
Yeah,
gonna
get the secretions cleared out.
let's give him some multivitamin too. And if he's having the pancreatitis thing, then we can even give him the pancreatic enzyme supplementation.
Inhalation.
Oh yeah, this one. Let me change that. Whatever, there was some mistakes, I think. Let me take this out. Take this out. Amoxicillin. Lavulonic acid. Or you can, this one you can just write it as augmentin.
Just write augmentin, yeah.
Then albuterol. Okay. Now we can give him regular diet. There is no need for NPR. Yeah. Some of bed rest. He can ambulate as well. What else? What do you want to do? Let's get some labs, right? Let's see. Just monitor him, right? What do you think? Okay. So now the CBC shows in neutrophilic leukocytosis. Sweat chloride is 85, which means it's positive. Chest X-ray, hyperinflation of both lungs, opacification of paranasal sinuses. Gram stain of sputum does not show any predominant organism. Sputum culture is pending, and fecal fat is pending too. So what do you want to do right now?
fecal. Okay, so nothing. Just kind of
Yeah, just observe him. Just
observe. Yeah, just give him.
yeah,
Is he inpatient? Okay, so just like give him diet and continue most like his fluids and supportive treatment.
yeah. So now just do a quick physical test. Just check on him once he there. Yeah, he's feeling better and stuff like that. Okay, so all children who suspected with cystic fibrosis should be admitted to the hospital.
Mm.
And what is the best initial labs is that you test the baseline testing. That's
Mm-hmm.
an important, like CBC, BNP, pancreatic function test. Those are the important things. So, but the treatment mainly, what are the main treatment component for cystic fibrosis patient?
The main treatment component,
Yeah, like you give them antibiotics, right?
that's just treating the underlying disease that they're having. I
Yeah,
mean, not
yeah,
the
yeah, yeah,
disease,
like
like whatever symptomatic treatment for that moment.
yeah. But we give them this DNAs. This is important. And
DNAs?
yeah, for those like would have daily productive cough plus airflow obstruction, because the you know what the DNA, you know the cystic fibrosis, like when you have
Yes.
infection, the
Yeah.
DNA is so thick. So when you just lyse the DNA, this is gonna help them a lot.
Mm.
Okay, and when do you prescribe physiotherapy and exercise?
Physiotherapy, if they have too many episodes of pneumonia and secretions,
Yeah, they have a lot of secretion. When do you give inhaled steroid?
when they have wheezing,
Yeah, when they have airway hyperactivity. Same thing with the bronchodilators. When you give oxygen.
when they are hypoxic,
Yeah, when they have hypoxia at night or rest, or when they have pulmonary hypertension.
hmm
When do you give antibiotics?
when they have some kind of infection like pneumonia.
Yeah, when they have increased sputum production, fever, dyspnea.
Mm.
Okay, so that's the thing. So what do you give for staph aureus antibiotic?
For Staph aureus, Vinco,
Yeah, you give them cephalexin, dicloxacillin, or augmentin. How about for pseudomonas
mm,
and cystic fibrosis?
I don't know.
So there are oral medication like ciprofloxacin that can cover that, or you can give them IV, streptomycin and piperacillin. Okay.
Mm-hmm.
What is the most definitive treatment for cystic fibrosis?
They usually have a lot of like issues with lungs, like pneumonia, bronchitis, cough, sputum. So they have issues with secretion, getting rid of mucus plugs. So I think lung transplant.
Yeah, good job. Yeah, lung transplant. And the usually FEV1 will be like 30% or less than predicted. And what type of diet do you recommend for these patients?
They should be on definitely on pancreatic enzymes that they should get because
Yeah,
their pancreas is not working. We should definitely give them vitamin A, D, K, and E, the fat soluble, because that's also not working. We should give them I don't know, um,
yeah, excellent. We give them high protein and high calorie diet. That's important. You give them fat soluble vitamins and
mhm,
pancreatic enzyme replacement. This is very
yeah,
important.
hmm
Okay, especially if the 72-hour fecal fat elevated.
yeah.
Okay, so now this is the same patient. So the sputum showing the sputum culture staph aureus sensitive to cephalexin. So what do you do right now? Do you want to change
It's,
some antibiotics?
yeah, we can give him cephalexin.
Let's just discontinue the augmentin then.
Yeah,
Let's give him cephalexin. And what do you want to do the cephalexin? How? What route do you want to do?
Oral.
Yeah. Good.
Because he's gonna go home.
Yeah. What else do you want to give him? Give him some
Give him
vaccine?
pneumococcal vaccine
Okay.
because he's very
Yeah.
immune.
Let's consult dietitian too.
Yeah.
Let's give him pancreatic enzymes, eh?
Mm-hmm.
What else?
Influenza
Let's do
vaccine.
genetic counseling. Okay.
Mm-hmm.
Cephalexin oral. Vaccine, give him influenza and pneumococcal. Intra. No. High protein. Oral. Counseling and counseling. Yeah, that's it actually. Just if he gets better, let's just follow up with him in next month or so. Feeling better, so now that's about it. Okay, so this is for this case. Okay, so if we want to do a summary for this case, once you have a kid with a cystic fibrosis, the first thing you do is admit him. Then you do the police BS and V panic, and you order the 72-hour fecal fat and sweat chloride, sinus
Mm-hmm.
X-ray, plus the infection protocol, which is chest X-ray, blood culture, sputum culture.
Mm-hmm.
And then once you find out the chest X-ray there's an infection, so you give him Augmentin, you give
Mm-hmm.
him albuterol, like steroid if there's a wheezing and stuff, chest physiotherapy, multivitamins. That's the thing. Until you wait for the culture results. Okay. Once you get the sputum positive for Staph aureus, you change it to cephalexin. And if the fecal fat is elevated, you add pancreatic enzymes. And you give them influenza vaccine, pneumococcal vaccine, and consult dietitian and genetic. And that's about it. If they suspect Pseudomonas, then you give them topramycin and piperacillin. That's the thing. So that's the thing. And the first case that we had is that it was hypothyroidism case. So the first thing you do the cuticle, and
Mm-hmm.
then you see the TSH. After that, once you find a high, you order T4, and you start levothyroxine. Okay, and then you follow up in 1 week and just counsel them, and that's it.
Mm.
Yeah, that's it about it. So it's a summary for these two cases. Okay, so that sounds good then. Do you have any questions? Anything to
No.
discuss? Okay, so sounds good. So I will see you tomorrow. You said tomorrow you will be busy?
Yeah, that's
Yeah,
why I was like, let me just do it tonight.
sounds good. Yeah, thank you for telling me that. Okay, so I will see you tomorrow then. The day after tomorrow, I mean.
Maybe
Hopefully.
Saturday, I'll let you know.
Yeah, let me know. Okay.